So percutaneous intervention is more or less a common procedure right now in present day cardiac care scenarios uh, in hospitals. And percutaneous interventions are available uh, even up to district levels in our country as well as in our state. But when it comes to taking care of certain subset of patients, like patients with a severe heart pumping dysfunction or patients with renal failure, so this is a very difficult physiological subset to do an intervention. And also sometimes patients with a significant anatomical abnormalities in heart blood vessels, like presence of blockage in left main coronary artery, presence of blockages in multiple vessels, or blockage with a severe bone deposition or calcium deposition within it, and also chronic total occlusions, that is a complete occlusion of blood vessel for extending more than 3 months. So these kind of anatomical abnormalities are very complex subset. So many times we see patients having combination of these anomalies, like combination of certain physiological issue along with these kind of anatomical abnormalities. When it comes to treating these critical subset of patients, so if we do percutaneous intervention the way we are doing for a routine patient, obviously that increases procedure related mortality. So to reduce procedure related complications and procedure related mortality in these patients, we need to have a level 1 CHIP PCI care for these kind of patients. So what exactly we do in this level 1 CHIP PCI care is there should be an operator who can do all these complex interventions like CTO interventions, left main bifurcation interventions, and also handling bone deposition in coronaries for an adequate stent expansion. So operator who is capable of doing different techniques to successfully open blood vessels in these complex scenarios, along with availability of certain equipment, so which can be useful when patient is collapsing or when patient had severe pumping dysfunction, like so Impella and VIA ECMO. So when these devices are available, so we can place these devices in a patient with a severe pumping dysfunction, so that even if heart arrest happens during procedure, these devices will take care of circulation, giving an opportunity to operator to complete procedure. And also sometimes patients with renal failure where we can't use contrast because it may cause contrast-induced nephropathy in post-procedural phase, maybe day 3 or day 4. So we have to do procedures for these patients with either no contrast or ultra low volume contrast, so which can be done by intravascular ultrasound imaging. And if these patients, despite all the efforts, if they get deteriorated, we need to have a critical care team and mechanical circulatory support team and CT surgery team. So all these 3 teams has to come in no time to cath lab to assist interventional cardiologist in recovering patient. So these teams has to work parallelly on patient in installing support devices, and then planning post care, or also planning subsequent wean off, followed by subsequent definitive therapy. Sometimes it might be even cardiac transplant or LV assist devices. So when all these kinds of support systems are available in hospital, so treating these patients becomes very easy. Then only, so success rate of these percutaneous procedures will be high, and patients coming out of these procedures will be very good. So that's what is level 1 chip PCI center. So operator, having an operator, experienced operator, plus equipment related to all this circulatory support, and also and team to critical care and cardiac surgery to team who should be ready to come for backup in case if patient needs circulatory support, and also sometimes if not able to be enough to do the next procedure destined.